Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Famotidine. Its brand name is Pepcid. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We're going to start by talking about how Famotidine works. We'll discuss indications or reasons we would give this medication to a patient, then contraindications or reasons we would not be able to give Famotidine, followed by examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Famotidine work? Well, first of all, Famotidine is a histamine H2 receptor antagonist. It primarily inhibits both the concentration and volume of gastric secretion. In terms of indications or reasons we would give this medication to a patient, we often see it used in gastroesophageal reflux disease, or GERD. It's used in gastric hypersecretion. It can be used to treat a duodenal ulcer, as well as in the treatment of indigestion. Now for contraindications or reasons we would not be able to prescribe this medication, it would mainly be if a patient had a hypersensitivity to Famotidine or any other component of the formulation, or a hypersensitivity to other H2 receptor antagonists. Now for dosing, so in GERD or gastroesophageal reflux disease, we would typically see 20 milligrams orally twice daily for usually up to 6 weeks. In gastric hypersecretion, the initial dose may be 20 milligrams orally every 6 hours, with the option to increase this dose to a maximum dosage of 160 milligrams every 6 hours. For indigestion, we may see 10 to 20 milligrams orally twice daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Famotidine or Pepcid, so we'll go over some of those here now. About 2% of patients may experience diarrhea, while 1 to 1.5% may experience constipation. Dizziness may happen about 1.5% of the time, and a headache may happen to 1 to 5% of patients. Now, some more rare but serious side effects would be a seizure, which would happen less than 1% of the time, or hospital-acquired pneumonia if a patient was receiving this medication in hospital. That's all we're going to talk about today with Famotidine or Pepcid. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.